So we're going to talk about males over 60 and how urinary symptoms may affect them. And we've got Georgina Wilson, urologist, talking to us about that today. So George, can you tell us about what kind of symptoms men in their 60s may start to get urinary-wise?
Yeah, so men in their 60s can have a variety of urinary symptoms, and it can be anything from frequency and urgency, which we'd see in the younger population as well, through to problems that they may need to get up at night, or they may have a slow flow, or they may find when they do have a flow they can't start it when they'd like to start it, or they may have the opposite, that they have urgency that they can't stop it. The important thing is to recognise the symptoms and then go and speak to someone about them, because there are many things that can be done to help.
Okay, so who would they go to speak to first about it?
So normally we'd suggest going to see a GP in the first instance, and they will get you to fill something called an International Prostate Symptom Score, which is a score that we have linked to this app that people can have a look at, that asks about different domains of waterworks, including frequency, urgency, as well as the flow rates and getting up at night, and how much of an impact those symptoms have on you. If they have very little symptoms, you may want to do very little about it, and sort of that's the end of the journey for now. But if you have symptoms, particularly urgency and frequency, then you may want to do something called a frequency volume chart, which means that you can measure how much you drink and how much you pee, and look at some of the bladder irritants that might be going in, that if you change may help your symptoms.
Okay, so things can be done about it then. And what kind of treatments would be on offer?
So if your main symptoms is frequency and urgency, then the first treatment would be to avoid sort of irritating things to the bladder, such as caffeine. And on top of that, you may want to do some bladder retraining, which basically means trying to get your bladder to hold a little bit more each time you void, and there are some links towards that. If the main symptoms appears to be poor flow, so that when patients do void, they can't initially start and the flow seems quite slow, then they may want to see their GP about trialling a medication called tamsulosin, which is a medication that helps to relax the bladder neck and can sometimes improve flow in some men, but do come with a few sexual side effects, so it is something that's to be discussed with the GP before starting.
Okay, so they can get quite a few sort of tips and advice and medications from their GPs. Is there any sort of other options for?
Yeah, so if the medication doesn't work, they can be sent through to specialist care, where we would send them through to something called the Prostate Assessment Clinic. And during the Prostate Assessment Clinic, we'd repeat the International Prostate Symptom Score sheet, we'd repeat the frequency volume chart, and we'd get them to do something called a flow rate, where we get people to void into a machine that can measure how strong the flow is, and do a little scan to make sure the bladder's emptying. And based on that, depending on what it shows, if it showed that they had significantly poor flow, we may be able to offer operative intervention that can help. And there's many operative interventions now on the markets for different prostate procedures. We have things that are minimally invasive that may give some symptomatic release for a shorter period of time, and equally we have some slightly larger ones, such as transurethral resection of a prostate or a laser prostatectomy, which can equally give a longevity of keeping the symptoms at bay.
Okay, great. Thank you, George.
Thank you.